we're going to talk about longevity, and maybe for background, maybe you can update us on what the four most common chronic diseases are.
Okay, well, the four diseases that kill the most people in the US at least are number one, heart disease, number two, cancer, number three typically is what they call accidents, which these days is mostly drug overdoses. And so I think that's an indicator of really how far we've come in medicine, that the number three cause of death could be basically accidents. And then number four, and there's a big drop off, by the way, between cancer and heart diseases. Both of those are around 20% of the people that die from them. And then we drop down to like 5 or 6%. So there's a big drop off. And then it's respiratory diseases, stroke, Alzheimer's disease. It's kind of a mixture of these that are all there, and they kind of jump back and forth from day to day. Now, one of the things that I think is important to bear in mind, though, when we talk about this, is that just the percent of people that die of X is not telling us really everything we would like to know about its importance. For instance, men and women die at about the same rate from heart diseases, about 20% but women die on average about 7 years later than men do. So that's an important thing to bear in mind, as well as when people tend to get these diseases that ultimately kill them.
So two that you didn't talk about are diabetes and neurodiseases, Alzheimer's. You did mention Alzheimer's, but where are they?
They're right there. They're close, you know, and at one point Alzheimer's disease was number four. Of course, everything was distorted in 2020 and 2021 by COVID. You know, COVID in those years was the number three cause of death. But no, those are all right there. In fact, diabetes and Alzheimer's diseases are some of the ones that have increased in the 21st century. And that's because people are living longer. And I think that's one of the reasons to bear this in mind. Like if you looked at the statistics from 1980, you'd find about the same percent of people were dying of cancer then as now. But now it's later. So that's a big change.